Thank you for joining us for our weekly series, Viewing Multidimensional Poverty from Many Angles. I'm James Foster, co-director of the Institute for International Economic Policy, or IIEP, located in the Elliott School of International Affairs of the George Washington University here on our nation's capital. I'm joined by Sabina Alkire, director of the Oxford Poverty and Human Development Initiative, or OPHI, live from Bhutan, where she's working on measuring gross national happiness. We are glad that you have joined us today for the presentation, The Impact of the Emergency Social Safety Net, ESSN program on Multidimensional Poverty of Refugees in Turkey, by Nils Grede, who heads up the UN's World Food Program efforts in Turkey. As you may know, the World Food Program is the largest humanitarian aid program, whose unique role in alleviating hunger was recognized with a 2020 Nobel Peace Prize. Congratulations to you and your team for your part in this great honor. Today's discussants, Felix Schmieding, first discussant is a statistician from another part of the UN system, the Joint Data Center on Forced Displacement of the World Bank and the UNHCR. That's the UN Refugee Agency. And the second discussant is Cheryl Harrison of the World Food Program. Welcome, Cheryl. Thank you, all of you, for being here today. In just a moment, Sabina will describe the series and introduce today's speakers. But first, I'd like to say just a few words about our institute. IIEP supports faculty research and teaching and convenes nonpartisan discussions of the key questions facing the international community, like the one we will cover today. Last Wednesday, our Facing Inequality series brought Neil Cummins from the LSE for a discussion of his paper, Hidden Wealth. While next week, on the 11th, the IMF comes to GW to present its Global Financial Stability Report. Last week's multidimensional measurement series featured David Stewart of UNICEF, discussing policy uses of multidimensional poverty measures. And next week, Yeshwas Admasu of the World Bank continues today's theme with his presentation, A Multi-Country Analysis of Multidimensional Poverty in Contexts of Forced Displacement. I hope to see you there, but if you miss any of our events, you can watch them asynchronously on our YouTube channel, IIEP GW. Now, without further ado, let me turn it over to Sabina for her comments. Sabina.
Thank you so much, James, and thanks to all of you for joining this seminar. The aim of this series is to look at multidimensional measures, but now not from the perspective of academics or even of those who are producing the statistics, so much as those who are producing and using them in a policy environment in international institutions. And so it's a real delight to have Nils Grede and colleagues from the World Food Program sharing their innovative work on using an MPI, particularly to look at certain communities and also to look at measured impacts of their social safety nets programs on refugee communities in Turkey. So I think we're really in for a treat today. Nils Grede, as James said, directs the World Food Program in Turkey. And before that, he directed the World Food Program in El Salvador, and previously was a deputy director in Jakarta, and also Brazzaville, Congo, and Swaziland. So many, many different experiences. He's also had times in the headquarters working on nutrition and HIV/AIDS, and also in Boston. So we have lots of experience. But what's really impressed me as we've collaborated with Nils has been the way he can balance an overview from the institutional and management perspective with a fascination for the details of measurement and of how policies function. And it's this nexus that he'll focus on in his presentation. Felix Schmieding will be the first discussant, and he's a senior statistician from the Joint Data Center on Forced Displacement. So he's worked with UNHCR, UNDP, UN Statistics Division in many different regions, again, Asia, Africa, Caribbean, on different kinds of data sources. And so he's really looking at the methodologies and the use of these statistics from a rigorous data standards perspective. And Cheryl Harrelson joins as the Deputy Director of the Cash-Based Transfers Division of WFP in Rome. And her angle is to get more money into women's hands. So she works on women's economic empowerment, digital inclusion, and the government-to-person transfers. So how does World Food Programme, that does a lot of cash transfers, work with governments to also advance the benefits of this population? So the discussants really bring different and new angles, and we're really looking forward to this exchange. So over to you, Nils. We are grateful and look forward to your presentation.
Thank you very much, Sabina, and thank you for having me. I'm excited to be here. I'm going to try to go through the 20 slides I have in about half an hour. If Bertrand, you could start sharing. And I've divided the presentation in 3 different chapters. The first one being to explain a bit more about what the Emergency Social Safety Net Program is, because I assume that many of you may have heard about it, but won't know much detail. So that's a bit of background that is helpful to then understand the second and the third chapter. The second chapter then talks about how we have been working with OPHI to improve on our multidimensional poverty measurement, so that we can better target and also better measure the impact of the program. And the third chapter is then about the impact of the program. So I'll start with an overview of the ESSN. I should say, first of all, that the ESSN is a part of the EU-Turkey refugee deal from 2016. It started implementing in December 2016 with 3,000 households and reached 1 million households in September 2017. WFP has, together with the government of Turkey, under EU funding, ECHO funding, and with our partner, the Turkish Red Crescent, designed and implemented the program. And we handed it over about a year ago at the end of March 2020, so just at the beginning of COVID. So all of the data that we're using in today's presentation, it reflects the 4 years that we were implementing the program. As many of you know, Turkey hosts the largest refugee population in the world, providing them with legal protection status. Syrians, especially in Turkey, have free access to education and to healthcare, as long as they live in the province where they're registered. So this is one of the issues when they move within the country. They need to ask for permission. When they don't do that, then they lose access to some of the services. And very important, as in many contexts where we do assistance, it's rarely ever that there's just one program, right? So in Turkey, the ESSN is really part of a broader ecosystem of assistance. It's the biggest program of many, many of them also financed by the EU. And it supports vulnerable refugees by providing unconditional cash assistance. So the assistance is completely unconditional. The purpose of it is to meet the basic needs. Now, when we talk about this ecosystem, we will find different programs, and the programs differ in terms of how they target and the conditionality. So we have the ESSN, that is an unconditional transfer program, as long as you meet the targeting criteria, the eligibility criteria, and I'll explain those in a minute. But we, for example, have in that ecosystem also the conditional cash transfer for education that the Turkish Red Crescent implements with UNICEF, which is conditional and targeted at a category, i.e. at school students. And of course, the conditionality is on attending school. We have some programs that target households, others that target individuals. The ESSN targets households, whereas, for example, the categorical transfer, such as the one for education, targets obviously the individuals. And then we have a whole host of different targeting mechanisms. And whenever you set up a new program, you need to think through very carefully, how do you want to target? And the easiest, but the most expensive usually is universal targeting, i.e. everyone is included, often in an emergency after an earthquake or in a drought situation, etc. Often you target an entire population in a specific area. Then there's categorical targeting. I just mentioned the example of school children. We also have under the ESSN an element called the disability allowance. If a household has a disabled family member, they get an additional monthly transfer. So that would be categorical. And then we have the 2 targeting mechanisms that we're mostly using under the ESSN. Here on this slide, you see them as ESSN1 and ESSN2. That refers to the early phases, the ESSN1, 2016-17, where we exclusively used demographic targeting. And the reason for that is that the EU-Turkey deal was decided in March. We needed to start later that same year, so we had very little time to prepare, and we had very little data about this population that had arrived in Turkey relatively recently. So instead of going for a scorecard system, which is the second approach that you see on the right-hand side, we didn't have the time because that would have required enormous capacity to visit thousands and thousands of households. So instead, we went for demographic targeting, selecting proxy criteria that in our experience and view mapped poverty the best, knowing that that's not a perfect way of targeting. First of all, there is no perfect way of targeting. Every targeting system has its issues, its pros and cons. But with the demographic targeting, of course, we use proxy criteria, and therefore we have some inclusion and exclusion error. To remedy that issue that we were quite conscious of, that we would have an inclusion and exclusion error, we later on in 2018 introduced a scorecard-based system in addition to the demographic targeting. So that allowed household visits to occur after somebody had been included in the program, or for very poor households that were not included because they didn't meet the demographic criteria. It would allow also to visit that household, and based on the assessment of the social worker, based on a checklist, this was a second route into the ESSN. So at the beginning, for the first year and a half, we only had one route into the ESSN, the demographic targeting, and then to help us reduce inclusion and exclusion error, we introduced the household visit channel as well. Now, what are the demographic criteria? Here on the left-hand side, there's 6 of them. The 2 most important ones are households with a high dependency ratio, that it counts the number of dependents, i.e. old people or children, over breadwinners, over adults that can earn an income, and households with at least 4 children. Those are the 2 most common entry criteria for the ESSN. And then there are a number of criteria that automatically qualify you as eligible, but they're not as common. Elderly headed households, very few of those exist in Turkey. Single parents, there's quite a few of those. Single females are always included, as well as households with a member that has a disability. Initially, two members with disability, that was later changed. In addition to that, we have the 2 additional transfers for school children, the conditional one, as well as the disability allowance that I just mentioned earlier. That was introduced also in 2018. Next slide, please. So the ESSN has changed over time. It was not always, you know, we as I said, we had to start rather quickly, and so the whole purpose was to be intelligent in implementation and to learn from the first few months and then to adjust as we go along. One thing I should also say, the ESSN, both the government of Turkey and the EU did not want to include all refugees. We were requested to target the most vulnerable ones, which was challenging because the refugee population in Turkey is a relatively homogeneously poor population. And so that's something that we've grappled with all along. And of course, the targeting was the way to kind of solve this issue. But I don't think that we ever completely solved it because it's very challenging. But also the ESSN was never meant to be to replace income from labor. So it was always, the transfer value was set from the very beginning in a way that people would have to add additional income from informal labor, from the black market, usually. And the transfer value was set in a way that this would then help them complement their income so that they could meet their monthly expenditure needs. So what changes were made over the years to the ESSN? They're here in 3 groups, 1, 2, and 3. The first change relatively quickly after the introduction of the program in June 2017. So I mentioned earlier we started in December 2016, so 7 months later, we made 2 of the criteria more flexible with the aim to increase the eligibility. So we were somewhat behind the scale up that we had been expecting because the criteria ended up being too stringent and too much excluding too many households. You may remember I said that we had very little data about this population. So a lot of the assumptions we made, the estimates were based on assumptions. And the assumptions turned out that they were too conservative. So the dependency ratio was made more easier to achieve. So instead of greater than 1.5, it was greater or equal than 1.5. 1.5 would be a household with 2 parents and 3 children, 2 adults and 3 children, or 2 adults, 2 children, and 1 old person. Before, one needed 4 children in the household to be eligible. Now, with just 3 children and 2 parents, you were able to be eligible. And the disabled member criterion was reduced from 2 to 1. There were very few households that had 2 disabled members at the percentage that was required. So that change was made very early on. Also, in the same June 2017, we increased the transfer value, the only time we were able to increase the transfer value. Initially, beneficiaries received 100 liras, which at the time was about $30, and we increased it to 120 liras. So a 20% increase, although the lira over time and inflation, etc., it's not exactly in terms of purchasing power, it's slightly less than a 20% increase. And we introduced the severe disability allowance that I mentioned earlier, which is about 600 lira per person for those that can prove that at least 50% disabled. Quarterly top-ups. This is a one-time payment for each household at the end of each quarter. And this figure was, or this mechanism was chosen because the transfer value was very, very sensitive for social cohesion reasons. Of course, Turkey hosts a huge refugee population, and the ESSN is a very large program, very visible. And there was a lot of talk, rumors in the host population about all the richnesses that refugees were being given in Turkey. And so the government was quite sensitive to that in order to ensure that social cohesion remains positive and good, and wanted to find ways, if we needed to increase the transfer value, to not do so in a very visible way. So many people knew exactly how much was being transferred to each person. What we did introduce to make it a bit less transparent or obvious, easily communicated in the media, on social media, etc., was at the end of each quarter a top-up. A small top-up for large families and a bigger top-up for small families, because the smaller families usually have less economies of scale. So that was a way of tackling both the needs of the beneficiaries, but also dealing with the social cohesion challenges. Then we've introduced later on a new mechanism, and I talked about it earlier. This is the household visit-based targeting mechanism. So the ability for social workers locally in the cities and towns to visit households that had been excluded based on the demographic criteria, and to go through a checklist to possibly include them, and to visit households that had been included to double check whether the demographic criteria had really identified poor households. Now, this was a mechanism we allowed up to 5% of the local caseload to be selected through this mechanism, so there was a clear limit set to it. But again, against our expectation, the rollout of it was much slower than we had expected, and we still today haven't reached the 5% quota that was allocated. So to some extent, it was a very good innovation. However, the rollout was way too slow to allow us to quickly address both the inclusion and exclusion error. Next slide, please. And the next slide shows us the exclusion and inclusion error. On the left-hand side, we see the exclusion error. These are 3 different poverty measurements. It doesn't really matter this much for the purpose of the presentation which one we look at. But you can see at the beginning, in June 2017, when we changed the criteria, obviously by making the criteria more looser, so to speak, easier to achieve, and the purpose was to include more households in the program. And that was achieved. The exclusion error, depending on if you take the extreme poverty one, went from almost 40% to 10%. And then you look at the yellow, blue, or red graph, it more or less hovers around that same amount. So it does no longer change very significantly, goes up and down. So at the time, we decided clearly we wanted less exclusion error without having the discretionary mechanism of the household visit. That meant automatically we would increase the inclusion error. So on the right-hand side, you can see the blue graph, how the inclusion error increased gradually from 24% to almost 40%, to just over 40%, and then started declining again. And interestingly, without being able to prove it, we assume that the decline that happened from December 2018 is related to the inflation in Turkey. So mid-2018, we had a currency crisis. that led to 25–26% inflation by the end of the year. And given the transfer value was no longer being increased at that point, but had remained at the 120 liras plus the top-ups, we then started basically, the value of what was being transferred was being eaten up by inflation, and therefore also ever more households, became, moved out of the inclusion error category into eligible household that should be targeted. So what does this show us? The trade-off, of course, between increased coverage and the inclusion error to a lower exclusion error. And, one way out of that, the second targeting mechanism that was based on household visits with the challenges that I described. Next slide, please. So that's kind of the ESSN in a nutshell. How it was born, how it evolved over the years, how we learned from the data we were collecting. Now I want to talk a bit about our work with OPHI on how we have improved our measurement of multidimensional poverty in the last couple of years. Of course, as WSP, we're a very data-driven organization, both for targeting and for impact measurement. Often we call it M&E. It's critical that we have good data sets, and the ESSN being our largest cash transfer program in the history, we had the luxury to be able to invest a lot of resources in a proper targeting and M&E function, and extensive surveys that were conducted either face-to-face, visiting the households, or by phone, by call center, by our partner Turkish Red Crescent. So we had the luxury of having a lot of data. Based on these data, in 2019, we designed the first multidimensional poverty index based on data that was collected in mid-2018, basically. And that was done based on our best experiences and knowledge, etc. And this multidimensional poverty index was the one that we wanted OPHI to review and to improve on. It was one that was basically built based on our program experiences in other countries, and it was not specific to refugees. So one specific request to OPHI also was to make it more targeted and tailored to the needs of refugees. For that, OPHI used both the existing indicators, expert interviews, focus group discussions, and also an analysis of the existing conventions, the 1951 Refugee Convention and the 1967 Protocol. So this slide now shows some of the changes that OPHI proposed to our multidimensional poverty index following the Alkire Foster methodology. And we can basically summarize in three ways. On the right-hand side, let me explain first to you. You see the outcome. You see the index. The index contains 5 categories: education, health, food security, income, resources, and living standards. These did not change from what we had designed in 2019. And under each, there's a number of indicators. And you can see them here. 2 for most of the areas and 4 for the living standards one. So what OPHI did here was a number of things. First of all, there were redundant indicators. So for example, under education, where now you see 2 indicators, we also had 2, but both of them were focused on children, on education during child age. And so they were completely overlapping, and not surprisingly, they produced in the data almost exactly the same results. So a household that was deprived on indicator 1 was as deprived on indicator 2. So they were not useful to have both of them because they were redundant. So one of them was removed, and instead, in yellow, an indicator was introduced on adult education. Under income resources, both of those indicators look different now from what they were in the first design of the multidimensional poverty index. Again, 2 indicators were, in both cases, merged because they were redundant, and the new one was included. Something similar happened in the living standards category, where we both asked about whether households had a kitchen or had a toilet. And both of those indicators, interestingly, showed very similar results. So again, redundancy. We decided that the toilet was more important than the kitchen, and so we just retained the toilet one, knowing that it would also tell us practically about whether people had kitchens or not. We would have liked to introduce, or OPHI would have liked to introduce, a water indicator. However, it turned out that 97%, I believe, of the household had good access to water. And so it would not have been a sufficiently a discriminatory indicator that would have allowed us to identify a significant number of deprived households. So that was discarded, but maybe a lot more relevant in other refugee settings. Instead, something new was introduced based on the focus group discussions with the refugees. OPHI realized that winter assets was something, Turkey being a country with cold winters, was an important indicator that was missing altogether, and that defines poverty for refugees in Turkey. And so that one was also added. So these are just some examples. Then also we made the shift from statistical weights to nested weights, meaning every single category is 20% of the final multidimensional poverty index. And within each category, each indicator has the same weight. Now, of course, that means for living standards that has 4 indicators, given it has the same 20% of weight as every other category, that the 4 indicators have half the weight of the other indicators in the table. So this is a short overview of the changes we made. What is the key? What is so different? This indicator is now a lot more tailored to the experience of refugees in Turkey, to the extent of refugees to start with, but then also in Turkey specifically, and that's why I mentioned the water example, that in another setting probably it needs to be adjusted again. And that it basically is based on the refugees' rights and their own voices as captured through some of the focus group discussions. Next slide, please. How do we use this indicator now? So what we were able to do with the indicator is to check how well our targeting functions. Basically what this table shows on the right-hand side is the 6 targeting criteria that I mentioned before. So I'm reading from the top left, single female, top right, single parents, then going down, elderly-led households, households with disabled members, and then at the bottom, households with 4 or more children, and the dependency ratio criterion. Now, based on going back on the data that we had, we of course know all the ESSN beneficiaries that were found eligible according to the demographic criteria, and we can analyze based on the surveys, whether they in this multidimensional poverty index meet the criterion of being poor. And so we see that the first 4 criteria perform very well. Sadly, they're the ones where fewer beneficiaries enter the program. And the 2 criteria that are quite broad and that bring in most of the beneficiaries are not doing so well. So you see in the green boxes how many of the ones found eligible turn out to be poor using the RMPI. And that goes between 70 and 100% for the 4 first criteria. And then for the last 2, sadly, only about 50% each. So half and half. For the households with 4 or more children, 54% are poor and 45 are not. And for the dependency ratio criteria, it's exactly half and half. So that kind of confirms that there is a significant inclusion error. Keep in mind a relatively homogeneously poor population. So it doesn't mean that people have a Mercedes in their driveway. It just means that they're above the poverty line that we have defined. Also, maybe one thing to mention that we don't show in this presentation, we also realize that people move very quickly between poverty quintiles. So another challenge of these programs is that if I have a family member that gets sick, or I get a job, or I lose a job, very quickly I can move by several quintiles on these scales. So if I visit a household in January and I do the checklist and I measure their poverty level, I may find them to be poor according to my criteria and would include them. If somebody then gets a job 3 months later, they may no longer be in that same category. So this is another challenge, that the poverty levels are quite, when they are relatively homogeneously poor, that on top of that movement, it doesn't take much from quintile to one quintile to another. Next slide, please. So that gets us, I said I was going to talk about how is this RMPI useful. So I showed one example on targeting. Now I want to talk a bit about the impact. Because, of course, we wouldn't want to do any of this work if we wouldn't know that we're also achieving the impact that we've promised the government, the donor, and so on and so forth. Now, this slide shows 4 different impact indicators, and these are the traditional, I would say, traditional WFP indicators that we use from the very beginning of the program. So they're not the RMPI yet. I'll show the RMPI on the following slides. Just to show you, the 4 indicators are from the top left, acceptable food consumption, below it, the average debt, and then on the right-hand side, 2 different coping strategy indices. One, consumption-based coping strategies, reducing the number of meals, eating less preferred foods, those types of things. At the bottom, the livelihood coping strategy index. So taking children out of school, begging on the street, borrowing money, those types of coping strategies. Now, very interesting, when you see on the, let's look at the 2 graphs on the left, and then we look later at the 2 graphs on the right. The 2 graphs on the left, interestingly, red is the beneficiaries, blue is the non-beneficiaries. So, of course, we're always comparing treatment group against control group. And funnily, on both of those indicators, beneficiaries and non-beneficiaries started out exactly at the same level. And then you can see in both cases how the beneficiaries outperformed the non-beneficiaries. So you can see a similar trend, but you can see a gap opening up. So for the average food consumption, we can see that it improves for both the blue and the reds. However, it starts at the same 77% more or less. For the non-beneficiaries, it only reaches 84% at the best level, whereas for the beneficiaries, it reaches almost to 90%. And then remember the economic crisis, mid-2018, things are getting worse until they start stabilizing again later on. And they're, yes, so until they stabilize again towards the end of our monitoring period. Very similar for the debt, just in opposite signs, because debt is not a good thing to have. So the beneficiaries immediately started decreasing their debt levels until the economic crisis hit, when they started increasing again. And the non-beneficiaries didn't have that initial improvement, but throughout, basically, with one short interruption, increased their debt levels and ended up with much more debt than the beneficiaries. On the right-hand side, the 2 coping strategy indices, different. They start out differently. So the red is in both cases has much higher coping on both indices at the beginning, and that's the point of targeting. That shows that we targeted correctly the worst off households. And then both of the red lines cross over the blue lines, meaning after receiving the program, the beneficiaries ended up recurring less to coping strategies than their counterparts. So again, I think both of that made us happy. But also here you can see how, again, from mid-2018, things started to get worse for beneficiaries and non-beneficiaries. Now, I promised, let's move away from those indicators and let's look at the RMPI on the next page. So this is now taking all the same data, but applying the RMPI. What are the predicted potential outcomes for eligible applicants with and without the ESSN? So without the ESSN, we would have 67% roughly of the households would be poor. With the ESSN, that would go down to 49%. So an improvement of almost 18%. So that again shows that the ESSN was effective in reducing poverty amongst the recipients, amongst the beneficiaries. Now, where did this improvement come from? You remember that there were 5 categories in the RMPI, and there's 3 of them that contribute most to the improvement, and that is education, food, and living conditions. Now, the 2 that don't contribute, or almost don't contribute, are health and income, and that's not surprising because, as I mentioned earlier, the ESSN is not enough to make a good living. You need to still find a job in the informal labor market, and we know 90% or more of the beneficiaries are working as well, at least 1 person per household. That is before COVID, of course. And so in that sense, they're not that different from the non-beneficiaries. And health, everybody has free access to healthcare, as I said at the beginning. So therefore, we would also only expect a minor impact of the ESSN. You know, there's something called the demand side of healthcare, the ability to seek out healthcare that requires sometimes some cash, and that may be improved through the ESSN. So 3 categories are responsible for most of the improvement. Another interesting finding on the next page, when we look at poverty by arrival time. So this slide shows on the x-axis how long have people been in Turkey. Recent arrivals, and this data is probably from 2018. So when it says less than 12 months, it means taken from that time. less than 12 months, 1 to 3 years, 3 to 6 years. And you can see that for both beneficiaries and non-beneficiaries, regardless of the assistance, they improve over time, which makes sense. Poverty decreases as assistance gets settled, as refugees get settled in their host country. But also, you can see that it was most prevalent amongst the recent arrivals. So that would lead us to say we should probably have maybe gone for a universal targeting for the first 6 to 12 months before we then would have started the demographic targeting. Next slide. A few studies were done to measure other impact. I'm going to be very fast because I'm running out of time, as I'm being told. There was a lot of talk the ESSN may change fertility behaviors. Sorbonne University did a study for us that proved that it did not lead to more early marriages or to more children in households. However, some households, on average, had their third child a month sooner. Maastricht Graduate School of Governance looked at migration aspirations. The point of the ESSN from the European perspective was to keep refugees in Turkey by allowing them a dignified life. The study found no difference in the ESSN beneficiary aspirations to migrate onwards. So they were not more likely or less likely to want to migrate due to the ESSN. This may have changed as the economic crisis hit after the data that we analyzed. Next page. What was the impact on the economy? For every lira that was injected, GDP would grow almost by 2 lira, so a multiplier effect of 1.86 to 2.1. Also some impact on more companies being founded, more jobs created, but also more demands on the health service and the schools because of more enrollment and more patients, so a need for more healthcare and education personnel. Another slightly negative impact, price rises in some areas. Last study, nutritional status. This was done by Sabancı University here in Turkey. It shows that the Syrians, that migration, interestingly, from a nutrition perspective, was a good thing. So Syrians in Turkey today the children are less stunted than their peers back in Syria. So no big difference for pregnant lactating women or for women overall, but for the children, we see that they have closed part of the gap to their Turkish peers. In 5 or 10 years, we would assume that there will no longer be any difference in terms of stunting levels between Turks and Syrians in Turkey. That gets me to my conclusion very quickly. The ESSN has made a positive difference on the lives of targeted people. I described how we improved the targeting system over time with mixed results. Certainly, we can still do better. I showed how we collaborated with OPHI to improve the index that we're using to measure poverty, and how that can be useful both for targeting but also for impact measurement. And I did mention repeatedly how the achievements we had have been eroded due to the high inflation, as we were not able to adjust transfer values as much as we would have liked to for the social cohesion reasons. But the RMPI was very helpful to help us improve vulnerability assessment and targeting. It allows us to assess the vulnerability and poverty of the targeted groups, but also the performance of that system, that targeting system. It can be replicated in other similar contexts. Remember, water, you may want to change certain components of it depending on the context, but certainly we now have something that is more tailored to refugees than anything that we used before. And certainly, I think one of its biggest advantages could be that checklist that is used to evaluate the poverty of a household could be designed in line with the index. Last slide. I also showed that the ESSN's impact was not limited just to basic needs, which is, if you remember how we started out, that it was supposed to address the basic need, help households meet their basic needs. But we've also seen impacts on fertility, on migration aspirations, on nutritional status, even though that's not directly linked to the ESSN, and on migration aspirations. Good, and I'm being told I'm 4 minutes over. I think that's still under 10%, so I hope I'm not getting kicked out of the video conference. So thank you very much. I also want to thank the Turkish government, our partner, the Turkish Red Crescent, and the donor ECHO that, of course, made possible all this work. Over to you, James.
Great, thank you so much, Nils. Yes, you are about that percentage over, but we'll have to overlook it and move on to Felix. I want to point out that before I turn it over to Felix, that two of our colleagues are in the audience as well. Yanchun Zhang from HDRO, she's the Chief of Statistics, and Heriberto Tapia, policy specialist there at HDRO. Great to see you, and they are co-hosts, of course, of today's event. Now, turning it over to Felix. Felix.
Thank you so much, James and Sabina, and thank you, Nils, for this excellent presentation and for sharing with us these insights. First of all, obviously, I'd like to congratulate both WFP and OPHI on this great work that really pushes forward our understanding on multidimensional vulnerability and poverty among refugees, not only through this latest exciting offering, which is the Refugee MPI, but also the work preceding it, which was the MPI, Nils, that you mentioned, and also the MDDI by WFP. So I think this is really hugely relevant work because, as Nils has said, no targeting mechanism is perfect, but it's important that we push the limits of our understanding of vulnerability and poverty, and in turn, how we prioritize assistance, how this affects inclusion, exclusion. So I'm really excited about this work. I also see this work obviously as part of a broader, more recent shift by colleagues in WFP, UNHCR, the bank, and many others in the humanitarian and development community of exploring more complex concepts of vulnerability and deprivation beyond these relatively crude approaches that we tend to use around specific needs or demographic criteria. So, you know, talking about monetary poverty or its little sibling, if you like, ECMEN, this beautifully named economic capacity to meet essential needs, methods that aim to predict monetary poverty, like scorecards, probability indices, proxy means tests, cross-survey imputation, all these, and of course, multidimensional poverty measures. And I think really, you know, there's potentially two huge advantages, or at least two, of having a refugee MPI more globally speaking, if we can actually find one that we can all rally behind. And that would obviously be first, that it's not at all tied to monetary poverty, the accurate measurement of which, as we all know, requires quite a few heavy assumptions to hold, especially around capturing prices, which in my view often don't hold in refugee contexts, in particular when it comes to camp settings. And of course, secondly, that the data required is relatively feasible to collect in humanitarian contexts, and the many technical and resource constraints that we often find ourselves under in these contexts. So in sort of prefacing my own inputs here, I should say that I'm a statistician. I'm not an expert in designing or targeting assistance programs. There is another discussant following my own intervention who is much more knowledgeable than me in this area. So I will really try to focus my brief inputs on the sort of practicalities and implications of constructing a metric like an MPI in a refugee context. And I'll also try to approach this from a slightly broader angle than just assessing targeting effectiveness, because I really do strongly believe that a global comparable metric on refugee vulnerability has great potential beyond just targeting. So that said, I really did enjoy the technically very rigorous approach and documentation around the refugee MPI that I found in the paper that underlies Nils's presentation. And there's really many things to like about it. There clearly a lot of thought has been put into the selection of its dimensions and its indicators. It's nicely based in a stringent application of the Alkire-Foster method, its nested weighting structure, and the robustness checks that are presented are really quite convincing. So if we're discussing an MPI specifically for assessing the effectiveness of targeting in the ESSN program in Turkey, then I really have very little to add. I think, you know, it's a very convincing metric, and it's really nicely implemented. So the point where sort of the key point, or this key signal, or the key question that I want to raise is really, if we consider this as a starting point for a potential global refugee MPI that can be applied in other contexts, which I obviously think is very much worth exploring, then for me, the key question that I would like to raise for discussion today is really about what should be our starting point for this? Because as is often done when it comes to refugees, our starting point is obviously thinking in our own little sort of our own little humanitarian bubble, as you know, me more than anyone else is you know, guilty of. The starting point for this exercise was also a standalone refugee metric and a data inventory of the data that was available based on past refugee surveys, right? So basically, this is very valid and very pragmatic, but we do live in an area where the Global Compact on Refugees is our guiding star. We're talking about humanitarian development nexus all the time. We're talking about the paramount importance of refugee inclusion in national systems, of which, of course, the ESSN being sort of implemented through the government, as I understand it, is a prime example. But in the medium and long run, that also implies that when we think about data and evidence on refugees, we do need to think about analytical approaches that are first and foremost comparable with the data and evidence that we have on nationals and hosts. And thereby, we also need to think about alignment with international statistical standards and analytical standards and so on. So the point here is that this MPI is undoubtedly useful for assessing the effectiveness of assistance to refugees only. But I am wondering, how useful would it be when we try to understand and also, of course, communicate around the effectiveness of assisting refugees in a more integrated way? And just as a case in point, the World Bank is supporting a program on agriculture employment support for both refugees and Turkish citizens in Turkey, which it's in the name, includes both refugees and Turkish nationals. And I'm just wondering whether this MPI would also hold if we try to understand inclusion-exclusion dynamics of such an integrated program. So for me, really, if we think about a global refugee MPI, perhaps an alternative starting point for developing a refugee MPI would be to look at global or national approaches to defining multidimensional poverty, and then to expand them with some refugee-specific, maybe rights-based indicators. You know, we've had a lot of great inspiration from what Nils just told us. So essentially a hybrid that can speak to integrated approaches, but also does justice to the particular needs and rights-related and protection risks of refugees. And as I said at the outset, I really do believe that such a refugee MPI would be useful far beyond assessing targeting efficiency. You know, I'm thinking advocacy for evidence-based inclusion in national systems, all these kinds of things. And that's sort of the key question I want to put before us all for discussion. And that would be an easy sort of exit point for me, but I just want to not make it that simple and just immediately challenge my own proposal a little bit, because we obviously know there is a global MPI, but many countries adapt it to a national context. So what does that mean if we talk about something that speaks to the humanitarian development nexus? Are we talking about many different refugee MPIs based in the many different national MPIs, or are we talking about something more akin to the global MPI with modifications? A second challenge that I see is that when we use the global MPI as our starting point, then in the global MPI, we have both short-term and long-term indicators, which in a refugee context immediately equate to pre and post displacement sort of vulnerabilities, and that obviously affects the way in which we can use this and communicate around this. So that's I would think a tough nut to crack. And thirdly, when we talk about refugee context, and Nils made this very point, we're often talking about quite homogeneous subpopulations in terms of their poverty characteristics, but also, especially when we talk about camp settings, we're talking about also geographically clustered populations. So some of the more standard global MPI indicators on living conditions in particular will tend to exhibit quite homogeneous patterns for refugee subpopulations. And then the question becomes, how limited is the value of these indicators for differentiating between households and individuals in that given subpopulation? So my proposal comes with a lot of issues and a lot of challenges, but it's just something for some food for thought. And I think with that, James, back to you. Thank you very much.
Thank you so much, Felix, for agreeing with the speaker and disagreeing with yourself. It was a very enjoyable presentation. Thank you. That is a really interesting balancing off of what the needs might be for such an index. I'll move on now to Cheryl.
Okay, thanks so much, James, and fascinating. I've heard Nils, speak about the ESSN a couple of times. I'm riveted every single time, and I learn something new every single time. There was so much, in fact, that WFP learned from that experience. So just wanted to give a little bit of a background, that it's background about me, but it's about WFP as well, and cash transfer programs. So when I first started in WFP, cash wasn't even a thing. We delivered all of our assistance in in-kind food. And, then by about 2009, we were delivering about 10 million a year out of, I think it was a 5 billion annual budget at that time. So still incredibly small, very, just testing things out. As of 2019, we've consistently been delivering over 2 billion in cash, which is about 40% of the program of work. So these kinds of issues are really important for us. We need to engage, we need to understand them as well. So about 40 million people we're delivering cash to, and a large portion of which are refugees. So I haven't actually worked in a context with the Syrian refugees. My refugee experience comes from 13 years in East Africa and North Africa, largely working with South Sudanese refugees, Somali refugees, Congolese refugees, and also internally displaced persons resulting from the genocide in Darfur, who are still today internally displaced. So I'm really coming from a practitioner and then senior management perspective on what it takes to provide cash effectively to refugees in very demanding settings. And there's a few things I want us to take into consideration. I really liked how Felix kind of like flip-flopped about the importance of a global MPI and then went back to question it, because at the end he was touching on a number of things that I'm gonna pick up on and speak about a little bit. So first of all of our refugee operations and UNHCR's operations as well globally are under enormous funding pressure. They're rarely fully funded. We assess the needs. We rarely receive more than 80%. 80% would be considered like a very well-funded program. Often we have programs that are 30, 40% funded against the needs. So we have to ask ourselves always, when we get this pressure to provide more targeted assistance to a population that is very, very poor and very homogeneous in most cases, are we really talking about targeting, or are we talking about prioritization or rationing what's available? That leads us into the discussion about depth versus breadth. So is it better to give fewer people, the poorest of the poor, a larger amount, or is it more effective to spread what you have evenly across the entire population, because pretty much everybody's in the same boat? In terms of communicating to the people we serve, and this is really, really important, it's one of the fundamental humanitarian principles, is that people need to understand what they're going to receive and why they're receiving it. It's much easier to communicate about universal or demographic categories that the population understands themselves to be more vulnerable. It's very difficult to communicate about any metric that has a large amount of data behind it and is essentially calculated through algorithms behind the scenes. Very, very difficult to explain why this person is going to get assistance and this person is not. That really, in and of itself, makes it difficult for humanitarian workers. We're on the ground, we can't explain it well. We really can't in most cases. And these are, essentially we're standing between people and their food. So this is become very heated moments sometimes. And in the process of trying to do this prioritization or targeting. And it does put our staff at risk. It does put the people who are receiving from us at risk as well. And it causes them to be, in some cases, ostracized or pressured to share. So we need to take those kinds of things very much into consideration. Also, Nils said, there is no perfect targeting, and Felix kind of touched lightly upon on the data issue. I can tell you there is no perfect data. So we're often using very sophisticated methods to distinguish who is the poorest of the poor, to identify who is the poorest of the poor. But we're using data that's highly flawed. So I think in Turkey, we had a real opportunity. Collecting the data was, I'm sure, was a big deal, and it was costly, but it was also possible. Very much more possible than it is, for example, in northern Uganda, when you've just had 1 million refugees run across the border from South Sudan, and they're in a huge dispersed geographical area, and there's a lot of movement. You know, they're moving on to try and find jobs elsewhere. So the same people are not staying in the same place all the time. Extremely difficult to get data on these people. And I often would ask myself, you know, how much data do we need to know that this person needs assistance? And just the invasion of privacy, showing up with your clipboard or your tablet at somebody's home, but it's really just a set of poles with a tarp over it, and asking them all kinds of questions about, you know, how are you coping? Are your kids in school? How many meals are you eating per day? You know, what kind of assets are you receiving? Do you receive remittances from it? It does feel very invasive. And I know that people in the Western world, in developed countries who receive assistance, are certainly not subjected to that kind of invasiveness in their privacy. So it's important to think also about how we treat people when we're collecting this data, and really, do we need that amount of information if we know already that as a whole the population is very poorly off. Remember also that these are highly distressed populations. Highly distressed. So they've seen their homes, their villages burned. Many of them have experienced sexual and gender-based violence. They've seen their family members killed. They've seen their adolescent boys taken off to become soldiers. I mean, they're very, very highly distressed populations. We can talk about asking for their consent when we collect data about them, but it's not real consent, is it? If we say you're going to get assistance. Now, please tell us all this information about yourself and your family. It's a conversation to be had, really, about consent and what we do with people's data, how much data we need to actually collect. I want to talk just to build on what Nils and Felix both pointed out as well. Some of you might know about the large refugee camps in Dadaab and Kakuma in Kenya, and there was a period where there were extreme resource shortages. In fact, this coincided very much with the beginning of the Syrian war. And so a lot of donors, humanitarian donors, were shifting their limited resources to other parts of the globe, so that some longer term refugee populations or refugee crises were receiving less than they had before. And we were asked, of course, by our key donors, you know, when we were alerting them, we're not going to be able to meet everyone's needs. We were asked, please, to target better. So we did do a very careful look at what it costs refugees to actually live in Kakuma, minimum expenditure basket, we call it. And we found that only 4% of the refugees, these are mainly South Sudanese refugees, also some Somali and other nationalities, only 4% were actually able to buy the bare minimum of what they needed to survive in Kakuma. So the cost of targeting that 4% out would in fact largely outweigh the cost of providing assistance to those people. Not to mention the fact that, as Nils pointed out, when you target, you inevitably wind up excluding people who do need assistance. Inclusion and exclusion error, once you start to target or use refined targeting, is inevitable. It was the same situation also in Uganda. Many of you will remember in 2016 when Juba melted down and the Equatorias flooded into northern Uganda. Once again, there was a conversation with the key donors about, how we don't have enough to make ends meet. We were asked once again to look at vulnerability and see if we could target better. And once again, it was almost impossible to distinguish. Everybody was so extremely vulnerable. There were no criteria that made sense in terms of being able to better target our assistance. So I just want to end off on a little bit of a positive note, because that was all pretty doom and gloom. But really,
you'll have to make it quick on that positive note, but continue, please.
Okay, James, thanks. I figured I was running out of time. Really, what do refugees want? There's 26 million refugees. There's 26 million refugees globally, and I'll bet dime to dollar that if you ask almost any of them, what they want is to get their lives back on track. So how do we help them do that? Is very refined targeting and of a poverty index, is that going to help them get their lives back on track and become self-sustaining again and contributing productively to the economy? We need to think about these larger questions. Okay, thanks so much.
Thank you so much. Really appreciate it, Cheryl, on the practical context of the problem we're talking about today. Let's return to Nils in just a second. Anyone who wants to give me a question in the chat, I'll try to reach it with the time left. Nils, you have a few minutes to respond to our discussants.
Sure. I think it was very interesting going to the discussion, should we rather give less but to everyone, is targeting actually the right way? That's why I tried to highlight that pretty much in most situations, there's more than one program. So in this case, we have the ESSN, we have the conditional cash transfer for education, we have the disability allowance, and there's other assistance that is being given that I didn't present. And all of them follow different targeting methods. So I think rather than making all the types of assistance universal, I do think that there is a benefit in targeting. But if you want to change a bit the weight, for example, you could channel in Turkey, you could channel more money through the conditional cash transfer for education, which is categorical, but all school children get it. And it gives you also the advantage of having channeling more money through a conditional program that incentivizes a certain behavior. So rather than looking at a program in isolation. Now, and I realize in many of the other programs, maybe you don't have that luxury to have a number of programs. On Felix's comments, I wanted to add one challenge to using the same indicator for host population and for refugees. Cheryl mentioned that we're using something called the minimum expenditure basket, and that is kind of to measure how much does it take for a refugee in Turkey to live a dignified life, and that includes food, but also all the other needs. And I don't know whether right or wrong, but we're calculating. There's a statistical. The National Statistical Institute calculates that for the host population. We are calculating a separate one for the refugees because we make the assumption that they need less, that they're less demanding, that they live in different areas and therefore pay lower rents, and so on and so forth, which of course gets me to say something I forgot to mention, that 98% of the refugees in Turkey live amongst the host population, are not in camps, which makes it also a very different population from many of the other refugee populations. So I think that, using the indicator for the program you mentioned on agriculture would be interesting, but I wonder whether we need to argue whether we can argue that the needs are the same between the host population and the refugee population. I'll stop here. There was a lot more, but I also want to give some time for other questions.
We have a question indeed, as of right now, from Yanshun Zhang. When you use nested weights instead of statistical weights, how did the MPI results change? That's the first question. Second, refugees are a group of vulnerable people with certain peculiarities, especially facing very unstable environment, socioeconomic, political, etc. MPI is a great tool to identify risky, vulnerable factors. Does your data and analysis reveal they become multidimensionally poor because they get sick, or lose a job, or lack access to social safety, or a combination of several factors? Thank you, Yanshin. Go ahead, Nils.
On the second question, no, that the data does not identify the reasons for the changes in our MPI. So I was referring to how sensitive the RMPI is and how little it takes for somebody to go from extreme poverty to maybe not so poor anymore, just because they found a job or just because a sick family member is no longer sick and that expenditure has gone away. Now, of course, if we went through the single questionnaires, we could potentially detect what has changed. One of our two main surveys that we conducted periodically is a panel survey where we kept asking the same households, and so where we could be comparing over time on which dimensions did things change. But I'm not aware that we did do such a longitudinal analysis looking at what may have triggered the changes in poverty. But what we did do is check whether people moved between quintiles, and we saw there was a lot of movement in both directions. So very poor people becoming less poor and less poor people becoming more poor. So that I would say on the second question. On the first question, our own MPI that was not an RMPI and that did have the statistical weights produced on a number of factors produced similar results. For example, we already knew that the two criteria that had the biggest inclusion error were the ones with 4+ children and the dependency ratio 1. However, of course, on balance, it's better to have. There is no perfect RMPI, so I also would argue that no index is perfect. But I think we feel more comfortable now that we're better capturing the refugee reality. But I wonder whether Frank or Matthew from OPHI or Sabina want to add on this specific question.
Sure, let's let folks respond if they want to. Go ahead and indicate, and then hold your hand up through the reaction function.
Yeah, sure. This is Frank speaking.
Go.
Very quick. There were several changes that we saw also between the two indices in regards to indicators. Certain indicators didn't make it into the new RMPI with regards to kitchen, for example. But we haven't put it into the report, but there were some strong differences between individual indicators that you can understand, because with the statistical weights you give certain indicators with lower frequencies a higher weight. So we can see that there's definitely certain strong differences that we can share in an email as well, but we didn't put this into the report. But giving all those changes of the index as well, we didn't follow up on this as much in the report as maybe for a different exercise.
Other comments on this? Yes, we have actually a quick response in the chat if you want to see to Yanshin's question from Matthew Robeson. Have a look at it. I won't read it out here. I'll just ask the following question if you all don't mind. I see the discussion of 98% of refugees intermixed with the local population. Would targeting and using these approaches, much like might be used with a standard national MPI, might this be actually helping to, in a sense, integrate the population to make it look like they're being treated as others? And so my question to you is, how does universality versus targeting, it seems that's one trade-off that you were talking about, might be seen in light of those data of having the kind of physical integration? And I guess I'll bring it back to Cheryl and then have Nils comment on that same point.
Definitely, and one of the many things that I didn't touch on that I wanted to in the time was the importance of host communities. First of all, host communities, for the most part, are pretty knowledgeable about the people who are fleeing across the border. For example, in northern Uganda, the Equatorias of South Sudan and the people of northern Uganda, they're the same ethnically. And South Sudan has had so many difficulties that often these are not, the refugee experience is not one linear experience. It's many instances of fleeing across the border. And those host populations are very good and very used to helping out the refugees, there's not the same stigma that the Syrian refugees experience, for example, in Istanbul and other parts of Turkey. But those populations in northern Uganda are incredibly poor themselves. It's one of the poorest countries of the world and one of the poorest areas of one of the poorest countries of the world. And you're quite right, James. This is where policy plays a huge and very important role. It should be, frankly, the refugee population and the host communities that are supporting them, because that'll make it much easier for the refugees also to find work, to integrate into the schools, etc. And it will maintain the social cohesion, which has been so important for the well-being of refugees in northern Uganda over time. So that's just one example.
Thank you so much for clarifying that. It's very interesting, Nils.
I wanted to distinguish between the camp setting, which is very different from Turkey, right? In a camp setting, I think Cheryl alluded to it, you have even more homogeneity because people live in the same living conditions, their income earning possibilities are very similar and often very few, etc. Now, in Turkey, if you think of 98% of them living amongst the host population, Turkey is a huge country. Each province has a different economy. In some provinces, there's more opportunities than others. Some provinces have, one province has over 50% refugees. In other provinces, it's less than 1%. Also, the ability of a refugee to integrate depends a lot on whether you have another few thousands like yourself or whether you're the only one in the neighborhood, so to speak. So I do think, therefore, Turkey probably lends itself more to targeting because the living conditions are more different than it would be in a camp setting. But for us, there was not really a choice at the beginning because I think both the logic from the donor but also the Turkish government was that this was going to be a program that was going to run for many years and that was creating an annual, so to speak, need for financing, and that it was not meant to replace the refugees' ability to earn their own income. It was only supposed to be a helping hand for the poorest ones amongst them. And so there was really from the very beginning a very clear mandate to target. In reality, if we had perfect data and we don't, and if we have perfect tools and we don't, we would ideally give a different transfer value to each person because everybody is different and everybody's poverty is different. But then, as I said, also, dynamically over time, each person changes, each household changes. And so we would want to modify the transfer value every month. We can't do that. That's one extreme. The other extreme is universal targeting, giving everybody the same, meaning if there's a fixed amount of money, we give a lot less. And I think there is the middle way, which is the targeted approach, which is the one we have chosen. I think we have always had a lot of concern that we would throw the baby out with the bathwater. But if we made this more universal, we would no longer be able to show impact. And we're able to show how there is differences in poverty levels amongst the refugees and how also the targeting system does target overwhelmingly those who are poorer, and how I showed on the slides how we manage to improve their lot significantly, and in some cases make them better off than the non-targeted ones. So I do think there's no perfect answer, but I do think this middle solution is probably a good one. And if you wanted to go more universal, you could also use some of the other programs that are already categorical. So for example, funnel more money to the households to the education grant or the disability allowance, rather than making every single program follow a similar targeting system. Last sentence, the donor always wanted very much an integration of this work into the Turkish system. And that's why we used the Turkish institutions, the Turkish bureaucracy, the Turkish IT systems, etc., that are also used for the host population. However, within those Turkish ministries and bureaucracy, the program is kept separate because it's funded by the European Union. And I think because, and this is my subjective impression, because Turkey was always afraid that it would get stuck with this caseload. And so it has made a very important point that it wants to keep this caseload somewhat separate from the host population. So in terms of your suggestion, James, to integrate, yes, that has always been the aim or the goal, but only up to a certain point, to maintain a visibility that there is a program that is funded by the EU.
Great. Well, we're going to finish up then in just another minute or two. Sorry for the delay, audience, but I thought I'd turn it over for a final word in an unusual twist to Felix, because in fact, knowing that the population is living among the refugee population is among the local population, host population, that does sort of shift the way of thinking about the choice between national and a refugee MPI. Does it do so in your mind, Felix? And then we'll bring it to a close.
Thanks, James. And yes, very much, I think so. If anything, I think it strengthens the need to approach this in a way that is comparable between refugees and hosts. It would be, if we had more time, I would ask Nils to tell us a little bit about how the government targets its own social safety programs, social safety nets, and see how that is different from how we target or prioritize targeting to the refugees. But I think bringing together at this point, James, that you raised, and the point that Cheryl raised about the need, or actually the point that also Nils raised about the need to communicate around this and make sure that there is no sort of jealousy, if you like, about special treatment, different treatment. If you can show that that the basic approach is the same, maybe we're talking about some additions to it. Maybe we're talking about slightly different thresholds, but in essence, the approach for refugees and nationals comes from the same starting point. I think that would address all of these things. But of course, I'm talking from the point of blissful ignorance, not knowing the concrete situation in Turkey. But in answering your question, James, I think very much so. Yes, I think that would lend itself to looking at that. Thanks.
And thanks to Jedediah for pushing that point at the end. Okay, well, that brings us to a close. We're over by a bit. And so I want to thank all of our participants today for their wonderful commentary, for the insight into the practicalities of applying the MPI in this context in order to evaluate, monitor, and see what's happening among a very important population. So we're bringing it to a close. Thank you once again for joining us this week for Multidimensional Poverty Discussions. We hope that you'll be with us next week.